Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to another episode of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. And today I've brought on one of our own here at HCP. And if you don't know him already, you're going to learn to just love him. Jake Yates, one of our compliance consultants, is our guest today. Welcome, Jake.
Hey, thanks, Jeremy. It's great to be here.
Oh, I love it. So if you don't know Jake, and many of you that are listening may know him, you've maybe worked with him if you're our client, but he's been a stalwart at HCP. And I want you to have a chance to get to know him a little bit. So Jake, give us some more of an introduction of yourself, your background a little bit, and what you're doing now here at HCP in your role as a compliance consultant.
Yeah, absolutely. Thanks, Jeremy. So thrilled to be here. I I love compliance. I love healthcare. I will fully admit that I am a nerd when it comes to compliance. So I've spent about the last 15 years or so, most of my career in some form of healthcare. So I started out for goodness, probably the first 10 years or so in different organizations doing things like medical record retrieval, Medicare audits, risk adjustment, and compliance. So super excited to have finally been lucky enough that HCP actually found me. I was one of the very lucky few. So I started in sales here, and then here years later, I am now a compliance consultant and loving every minute of it. So I got my compliance certification, my certified in healthcare compliance certification, and then actually just recently joined the founding cohort for the Certified Artificial Intelligence Professional in Healthcare Compliance certification program. So super
Very
excited to
cool.
be working that team on that and earn another certification. So thrilled to be here today to talk shop and talk some more about compliance.
Okay, awesome. Before we jump into the topic, it would be a failure on my part if I also didn't mention that we've been doing monthly webinars at HCP, trying to ramp those up and be a little more consistent so we can push out really good information, timely information to make sure that everybody's staying on top of the critical things. And our September one was a big hit. It was on OSHA. And so Jake, in the way that only he can do, dressed up as Willy Wonka and put together, one of the best webinars I think I've ever seen. So I'm just going to put a plug in that there's a webinar coming up in October that he also is going to be participating in, and then he's working on others. But I can assure you that it's always fun, and Jake finds a way to make compliance interesting, no matter the topic. So that leads us to today. With it being Q4, we're recording this now here at the beginning of Q4, and it's that time of year where organizations are starting to think about their requirement to complete a security risk analysis, or there's groups that maybe don't know what a security risk analysis is. So we thought it would be good to bring it up now. And if you haven't done one in the last 12 months, now's the time to really look into it. So Jake, first and foremost, let's start with, if you can explain what a security risk analysis is and why it's required.
Yeah, great question. So, a security risk analysis, or you'll also hear it called a security risk assessment or just SRA, it's one of these pivotal pieces of HIPAA security legislation that's really meant to help you identify and know how to protect your EPHI. So, it's looking at protection of EPHI from so many different angles to make sure that you're really understanding the potential risks to your data from a digital perspective.
Mhm.
So we're looking really specifically at electronic information and that electronic PHI versus any physical PHI. The kind of the whole point of an SRA is to look at three main categories or three main requirements of the HIPAA security rule. So that's looking at things like administrative, physical, and technical safeguards that we really put in place just to make sure that we are addressing various areas of risk as it comes to interactions with our data. So from there, it actually is a requirement. If you really want to dive into the legislation, I there is a requirement in there, says it black and white. Um, but any healthcare organization that does anything with EPHI, so whether you create it, you receive it, you maintain it, you transmit it. So a lot of times this is going to apply to business associates of providers, offices, hospitals, medical centers, and a lot of people don't think about that extent as well. If anyone's touching EPHI in any way, they actually are required to complete an annual security risk analysis.
Yep.
So the rule definitely clearly says it's not a suggestion. It is a requirement, but honestly, completing it is only going to benefit your organization. It's not going to make it less secure or anything. It's a tremendous value add for a risk management perspective for an organization.
Absolutely. And you can see, especially recently, there's been some, some major breaches and PHI, it's been compromised out there. We all remember, last year the Change Healthcare that still triggers some PTSD for a lot of people that we talk to in healthcare. That was so painful. But what you're starting to see, and in fact, the OCR a year ago, last October, launched what they called their risk analysis initiative to really start focusing more on this. They're making it more of a priority to ensure that organizations are doing this. Maybe talk briefly about that initiative, Jake. I know there's been quite a few actions this year that they've taken on this initiative.
Yeah, yeah, absolutely. So the initiative, really the purpose of it is to start focusing on the auditing and improving the completion of security risk analyses from any organization again that's going to be obligated because they have some type of patient data that they do something with. So initially this initiative has really aimed to just overall increase compliance with the HIPAA security rule. I mean, it's been there for years, and a lot of it just gets simply ignored, either due to lack of time or lack of effort or just general disinterest. Totally get that HIPAA is not everyone's favorite thing, um, but this initiative has really kind of helped to emphasize the importance of identifying and mitigating those potential risks to EPHI because there are a lot of them out there and we don't always realize that.
Mm-hmm.
So, a lot of things that are coming as a result of this initiative from last year is the OCR beginning to conduct more and more audits, random and targeted,
Yep.
on medical practices, but also we've seen a lot with covered entities as well,
Yep.
like medical device manufacturing companies and things like that, to really determine whether or not people are taking it seriously and taking the time to actually make sure their EPHI stays protected. So the OCR has rolled out all kinds of new educational resources, even their um, templated SRA tool has seen at least two updates in the last year. So a lot of tools like that have been now made more widely available to any healthcare organization that needs it. They're really taking out all the stop gaps to uh, allow people, will say, generally speaking, to not make an excuse as to why they can't complete one. They've
Absolutely.
really removed all of those stop gaps. I mean, we even just had another settlement that they just announced on the 30th, on Tuesday. So it's something that is continuing to be a very strong focus of the OCR because we are seeing an increase in incidents happening and it's still not being taken seriously.
Yep. So let's spend. I appreciate that. Let's spend a minute on, let's, so an organization, they go in, they complete their SRA, and then afterward, right, best practice is then to take a look at the results, to identify gaps, areas where you can improve, and then to develop and in return implement, not just develop but also implement, that's key. A risk management plan is typically what it's called in the process. Maybe talk about that process. What does it actually mean after the SRA to then develop and implement that plan?
Yeah, absolutely. So, I mean, the key result, I guess, of conducting a security risk analysis is first and foremost identifying your risk. No risk management tool like an SRA is going to do you any good unless it can actually tell you where you have a risk. From there, it's just about finding those areas and then actually making a plan to fix the problem and really reduce the future risk that's going to come along with that. One thing that I see a lot in my role, working with especially larger customers at HCP, granted, a lot of them have a much larger infrastructure,
Yeah.
but even in large organizations, sometimes that infrastructure is not there, and the SRA is kind of that key piece that will basically, maybe just put balloons and confetti and everything all over the areas of risk that you have. So it clearly shows you where your risk is. And the most important thing with that is even if there's a lot of risk in the organization after the SRA is completed, that is not a that's not necessarily a bad thing, because if we're identifying risk, we can identify ways to mitigate that
Yep.
risk, ultimately solve whatever problems out there that maybe we're not aware of or maybe we're not focusing on. So it's definitely not something we should be afraid of. It should be something we are I I will say excited, maybe for me, maybe not for everyone else, but it should be something we're excited to do because it's going to allow us to see if our even entire compliance program is being effective.
Yep.
And then give us exactly what we need to say, hey, these are some great goals for the next year or maybe the next 2 years we can work towards to making our organization better, safer, and more compliant.
Do you typically recommend, let's say there's 8 areas to address? I'm just going to use some fake numbers here. Um, I imagine, and maybe guide us, as you guide clients through this process, do you typically say, hey, over the next 12 months, let's pick these and work on these? Or do you try to put plans for all 8 in place, even if that's over a couple years? What's the best way to approach that plan typically?
Yeah. Great question. So, typically, with the security risk analysis, part of that is going to include some type of threat matrix that's going to kind of identify how much risk we have. So, if you utilize, a vendor's health security risk analysis or the healthit.gov's version, they have a matrix that will actually kind of show you as you answer questions whether you're in a low, a moderate, a high, or even a critical risk with based on how you answer the question in essence. So for me, I always focus on the critical stuff
Mm.
first. Those are like our mission critical. Those are the things that we almost want to say, okay, we need to stop the presses and we need to fix this right now. We need to put that plan in place. So anytime I see a critical level, for me, that should be an all hands on deck problem to fix, because the odds of something happening, maybe for example a cyber attack,
Yeah.
would be so much more significant than other risks happening in the organization. So typically I work from the highest risk down, that being, of course, identify that. For folks who have done a few security risk analyses and kind of know what to focus on or where their weak areas are, usually at that point it's just a matter of, okay, maybe we've moved this from a high risk now to a moderate risk.
Yep.
Okay, great.
Yep.
What are we still missing that is putting us at a moderate risk rather than low? So it's just about kind of identifying what the worst risks are and then determining can I take an action on this immediately,
Yeah.
or is this something that's going to involve more collaboration with like a compliance committee, or maybe we need some additional funding to, maybe do some patch testing or things like that that would require the use of another organization, or, you know, utilizing more time in our IT departments, things like that, that we don't necessarily have control over per se, but need the assistance of others
Yep.
to kind of reach that point.
Love that. That's really good. Um, and I imagine, just like with all of compliance, you're never perfect. And I think that's an important thing that I know we stress to our clients is, hey, you're not going to be perfect on everything, but are you getting better? Are you improving? Do you talk about it? Do you think about it? Do you discuss it with leadership? And are you working on getting better? And that's again the OCR. That's what they're looking for. They know no SRA is going to be perfect, but can you demonstrate that? Hey, here's where we were. To your point, we did this over the last 12 months. We completed another SRA, and look, we've made improvements. That goes a long way. It shows to the OCR that you care. You do take it seriously, and even if you're not perfect, that progress keeps you out of a lot of trouble.
Oh yeah, absolutely. And that's a great point. It really is more like a marathon than a sprint when
I
it
love
comes
that.
to
That's a great analogy.
it is that kind of, typically, I mean, I am not a runner. I don't even like running at all. Heck, I hardly like walking, so but so I shouldn't be one to talk. But for my friends and folks on our compliance team who are major marathoners, it's it's not so much taking off and just running with it. It's the steady, consistent moving forward that is the most important thing. And honestly, that's one of the things that, as I talk to some of our customers and clients at HCP, that I always like to tell them is no one is ever going to be 100% compliant. And if a company or organization can say, we'll make you 100% compliant, I hate to say it, but it's just a bold faced lie, because you might be 100% compliant for a minute, or there could be things going on that you're not even aware of that are major risks. So it really is about that just steady, consistent effort towards doing a little bit better and being a little bit better really every day.
Love that. Last question here. We're coming up on our time. You mentioned earlier that there are some tools and some templates out there. I know we have our own internally built tool that we use with our clients. Talk about, you know, are are templates the templates that they can go get out there, are they good enough? What's the risk and just relying on templates? I guess, what advice would you give to those that are maybe looking at doing this for the first time, or just trying to find additional help in doing it?
Yeah, great question. So, especially for smaller organizations or organizations that don't have a very large and robust compliance department, your risks are going to vary depending on your organization. I mean, even between specialties, even geographic areas, things like that really are going to determine where your risk actually is. So things like, HCP, obviously, like you mentioned, has a really great security risk analysis tool. Um, the one on healthit.gov is free for anyone to use, and they've just made some major improvements to that over the last year, and a lot of webinars and things to teach you how to use it and be effective with it. So templates are really good to kind of get you going, but they are not going to, you know, for lack of a better way to say it, they're not going to take you to 100%. They're going to take you far, but there's still action that you're going to need to take. Like, the template's not going to basically hold your hand and say, okay, well, let's type out this policy one word at a time. It's going to leave your responsibility to still do things, but it will certainly guide you and direct you to the areas to focus on, and really what to take the time to look at and really truly consider as an important or a risk that needs to be mitigated.
Love it. Jake, this has been so good. Thank you so much. Again, to those that are listening, take a look at our webinars, and we can even add a link potentially to it, so you can hear more from Jake and our compliance team. But we'll definitely have Jake on again, and we'll also put his contact information up. So if you've got questions about the SRA, whether you're a client or not of HCP, we want to help you out. Jake's happy to answer some questions, so we'll put his contact information up here as well, so you can contact him. But Jake, thank you so much. This has been so much fun. Thank you for coming on today.
Yeah, my pleasure. Thanks, Jeremy.
Absolutely.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.